prostate enlargement and prostate cancer. For prostate enlargement, a patient can be on drugs. There are two major drugs that are readily available in the market. One, the mechanism of its action is just to relax the muscle of the prostate so that the patient will not have much of those symptoms. One of those drugs is tamsulosin. If a patient takes 400 micrograms of tamsulosin every day, it tends to reduce all the symptoms of the BPH, that's the prostate enlargement, by relaxing the muscles of the prostate gland. You know, it squeezes on the ureter, that is the outlet, the tube at which the urine passes. When the drugs act on it, it makes it relax so that more of those urine and everything will go. The second type of drug that is very readily available at the over-the-counter in Nigeria is finasteride. Those one act by shrinking the prostate gland itself. It's also a daily dose. Use a 5 milligram of finasteride in a day. It shrink the prostate, thereby reducing all the symptoms. But in a patient with prostate cancer, there are 3 or 4 modalities for treatment. In a patient with BPH, that is prostate benign hyperplasia, after the drugs, if it's still not working, a patient might just wake up one day, want to go and urinate and see that the urine is not coming. That's what we call bladder outlet obstruction as a result of prostate enlargement. That might need an immediate surgery. The surgery for that, it's also divided into 2. Maybe you just do a surgery to just reduce the symptoms before the retrograde flow of the acquired urine in the bladder starts damaging the kidney. You can do what we call tapping. You just tap the excessive urine in the bladder by needle. You remove it, or you do a minor surgery that is called suprapubic cystostomy. A simple cut will be made. Urethral catheter will be placed to drain all the urine, pending when the patient is ready for a major surgery. Or otherwise, the patient might just go for a major surgery, which is called prostatectomy. Prostatectomy is just a simple urological procedure to remove the prostate gland. They do it. There are 2 open prostatectomy is there, and there is laser means of doing it, or they go through the urethra. All those minimal invasive surgery to remove the size of the prostate. So they remove the prostate, that's the surgical part of it. Then for the prostate cancer, a patient might go for prostatectomy to remove the prostate, then follow up with chemotherapy and radiation therapy. Most cancerous cases, you have to follow